How to care for your pancreas. The pancreas is vital. You can't live without it, yet it's rarely discussed. In this video, I'll share 8 tips to improve your health and prevent pancreatic diseases. The pancreas has many functions, which can be divided into 2 main categories. The endocrine pancreas, which you may know for producing insulin to regulate blood sugar, but it also produces another crucial hormone for our survival, glucagon. Glucagon has the opposite function of insulin. If insulin lowers blood sugar, glucagon can raise it. Now you might be thinking, oh, so glucagon is the bad guy? Is it the one that increases? No, glucagon is essential for our survival. Why? If you have hypoglycemia, very low blood sugar, glucagon increases to keep you alive. So glucagon and insulin with different roles are vital for our survival. That's why when you fast, even if you don't use insulin or any diabetes medication, you can still maintain good blood sugar levels. At least that's what happens under normal circumstances. One reason you stay alive is due to increased glucagon production. Another reason is that the liver can produce sugar. This also protects you in these situations. So there's hormone production, the pancreas endocrine function. The other main pancreatic function is producing digestive enzymes, crucial for proper digestion and nutrient absorption. Now, what diseases affect the pancreas? I'll divide them into 3 groups. First is pancreatic cancer. Have you heard of pancreatic cancer before? You've probably only heard of pancreatic adenocarcinoma, but there are other types like insulinoma, a rarer pancreatic tumor. I'll also discuss treatment options, but number 1 is pancreatic cancer. Number 2, another major group of pancreatic diseases, raised blood sugar levels. Type 1 diabetes, a pancreatic disease, destroys insulin-producing beta cells as the body makes antibodies against them. As you know, one of the pancreas's functions is insulin production. In type 1 diabetes, this cell destruction leads to increased blood sugar levels. This group also includes type 2 diabetes, not a pancreatic disease, as the pancreas still functions. Often it produces more insulin than normal, but the insulin can't work. This is what we call insulin resistance. It's not a pancreatic disease, as it's mainly due to insulin resistance. The hormone can't function, but the pancreas produces it. I'll group it here for clarity. The third group is when the pancreas doesn't produce digestive enzymes. For instance, people with chronic pancreatitis might have this problem. What's that? I'll explain chronic pancreas inflammation and how you can prevent such changes too. Another issue is acute pancreatitis, also in this group, which is a sudden inflammation of the pancreas. So how do we care for the pancreas? Well, there are 8 tips. Tip number 1 is to watch your triglyceride levels. Do you know what triglycerides are? They're a type of fat in our blood, and triglycerides, when elevated, especially above 500 or 1000, as some sources state, increase your risk of pancreatic inflammation or pancreatitis, which can be severe. This condition causes various symptoms and often leads to hospitalization, so it's crucial to monitor your triglyceride levels. Triglycerides are often overlooked in health discussions. While many videos focus on cholesterol, triglycerides are different but equally important. Unlike triglycerides, it's a risk factor not just for pancreatitis but also for heart diseases like stroke and heart attack. I want to emphasize the danger of triglycerides for pancreatitis. So how can you lower your triglycerides to healthy levels? What are these healthy levels? Less than 150. If not fasting, the reference is 175. But ideally, take the test fasting for good levels under 150. Here's a tip that really works. Avoid simple carbs like sugar, flour, cakes, and pasta, as well as added and refined sugars. Why? When you eat sugar and don't use it for energy, your body stores much of it as triglycerides. So reducing simple carbs, adding fiber, and avoiding foods I mentioned is one way to care for your pancreas. Plus, lowering sugar intake helps you better control your blood sugar levels. But I want to highlight triglycerides here. Did you know this tip? Has anyone told you about the importance of triglycerides? Have you had this test done? Write in the comments and mention which part of the world you're from. I'm from Porto Alegre, and I get this test done every year. Number 2, since I mentioned what to avoid with simple carbs to care for your pancreas, there are foods that can improve insulin resistance. Foods with nutrients that can help the pancreas, like dark leafy greens, which contain copper, which can aid pancreatic function, specifically the beta cells' function in insulin production. Other foods are also studied that can improve this, like coffee, which has antioxidants. There's even a study showing that those who consumed moderate amounts of coffee, about 3 to 4 cups of brewed coffee, 200 milliliters each, so 600 to 800 milliliters total, not more than that, or 3 to 4 shots of espresso, with each shot being about 50 milliliters, equivalent to 100 milligrams of caffeine, could reduce the risk of type 2 diabetes by up to 33%. But I've heard coffee is bad, that it can be harmful to the heart. In high doses, more than 8 servings a day, then yes, it can be harmful. Coffee can even increase the risk of arrhythmias after 8 cups of coffee, or 8 cups of brewed coffee, or 8 shots of espresso. Other foods like cocoa are also potent antioxidants. Fiber, as found in apples, can help boost your metabolism. Spices like cinnamon are also being studied for their potential health benefits. A diet rich in salads and antioxidant-packed foods can boost your overall health and benefit your pancreas. You've heard of fatty liver, but fatty pancreas is a newer term gaining attention. The pancreas can accumulate fat too, and proper diet helps prevent this. We now know that fat buildup in other organs can also occur in the pancreas. This isn't widely discussed yet, but you'll hear more about it soon. I'm sharing preventive tips now. Number 3 is about physical exercise. To maintain a healthy pancreas, regular physical exercise is crucial. Increasing muscle mass and improving body composition helps not just your pancreas, but your overall metabolism, blood sugar levels, and reduces other health risks. So what's the magic number? How much exercise should you be doing? And what's the best type of exercise? Aim for over 150 minutes weekly, spread across 3 or more sessions. That's 50 minutes thrice weekly. Or if you can, studies show added benefits if you increase to 250 minutes weekly. That's 50 minutes 5 times a week. It's more challenging though. I can meet this goal. Usually I do gym workouts 5 to 10 times a week. When I can't go to the gym due to my schedule, or if the kids are home crying, or there's a situation where I can't leave to train, I end up running. When they sleep, I go for a run, which also counts as exercise. As you've seen here, it can be running on a treadmill, outdoors, gym workouts, or swimming. I suggest choosing an exercise you're most comfortable with, okay? I won't be too restrictive, as it can make it hard to meet this goal. It's a high target, and not everyone has access to a gym or weights. So, you can exercise outdoors or at home. Do exercises you can reach, do and maintain long term. This is very important. Number 4. Avoid saturated fats and preservatives like nitrates and nitrites. This is controversial, as some say these don't increase cancer risk, especially bowel cancer or colorectal cancer. But here's the thing, eating these 3+ times a week greatly increases the risk, studies show. So if you eat it once a week, for example, at a special event or dinner, don't worry, a bit of salami won't give you cancer. That's not how it works. Here I'm talking about people who regularly include processed meats in their diet, for example, like salami, ham, parma ham, copa, salamito, and turkey breast, which are often thought to be healthy. So try to avoid these foods. It's very easy to consume them 3 or more times a week. If you think about it, it's easy to eat an amount that's already linked to increased cancer risk. So ready-made foods you buy at the store, like boxed burgers, frozen pizza, and pre-made lasagna, not just because of their high sodium content, but also due to preservatives, can easily put you at risk for various health issues. Number 5. Don't smoke. This includes e-cigarettes, roll-your-own cigars, and all types of smoking. Studies link smoking to up to a 6-fold increase in pancreatic cancer risk. Just by not smoking and avoiding it, you're already giving yourself significant protection. It's crucial to avoid alcohol, as it can inflame the pancreas, causing alcoholic pancreatitis, which can be very serious. Just as alcohol can harm the liver, it can also damage the pancreas. You ask where I spend most of my time, since I work in hospital care. It's inside the hospital, in the inpatient ward. There's always someone hospitalized due to pancreas problems caused by alcohol, so avoid alcoholic drinks, as alcohol can harm you just like cigarettes. More than one alcoholic drink daily increases your risk of alcohol-induced pancreas inflammation, so avoid or severely limit your alcohol consumption. And number 6, vitamin D. Have you heard about vitamin D? You probably only know its classic role, increasing calcium absorption for bone health, but we're increasingly studying vitamin D's non-classical functions, like its role in the immune system. Studies link low vitamin D levels, especially below 20, to increased autoimmune diseases like type 1 diabetes. So, maintain adequate vitamin D levels. What are the ideal levels of vitamin D? For most people, levels above 30 would be sufficient. This protects both non-classical and classical functions. In some cases, this may vary. For young patients without risk factors, doctors might aim for levels above 20. This isn't wrong. In other cases, slightly higher levels than I mentioned may be needed. I want to emphasize that vitamin D can also be toxic, so there's a potential danger. You can't just take vitamin D without monitoring your levels. You need regular blood tests to check these levels. Levels above 80 or 100 can risk causing hypercalcemia. High blood calcium can increase the risk of heart arrhythmias, not just kidney stones, which people often mention, but also heart rhythm issues. So be cautious with very high levels of vitamin D. As I said, this applies to both low and high levels. Levels between 30 and 80 are ideal, slightly below the upper limit for safety. Tip number 7. Don't take digestive enzymes without a doctor's recommendation. These supplements with pancreatic enzymes are also very popular right now. If you don't have any pancreatic issues, you don't need these enzymes or supplements promising to improve your pancreas or digestion. Only those with a medical condition and doctor's advice should take them. Be careful, as these can be harmful to you. There's no magic supplement or formula for pancreas care. If there was, I'd tell you. But lifestyle changes are what really matters. Stay away from these enzymes and miracle promises. You'll waste money and potentially harm your health. Here's the 8th tip for pancreas care. Weight control is crucial for various bodily functions. Did you know obesity is linked to higher pancreatic cancer risk? It also increases risk of other cancers, like breast and prostate cancer. We know that fatty tissue or adipose tissue is metabolically active. It can produce substances and even alter metabolism for the worse. So watch your weight, because we know that fatty tissue can interfere with insulin action, causing what's called insulin resistance. This is a major risk factor for type 2 diabetes. Did you notice I talked a lot about fatty liver? In this video, I explain more about it, including myths and facts about this very common condition. Click here to watch the video about fatty liver. Take care. See you next time.